Thanks for that, Xolani. The number of COVID-19 cases in the country has seen a steady increase and mostly driven by subvariants of the Omicron variant. South Africa has seen its positivity rate increase to 23% over the last few days. Gauteng, KwaZulu-Natal and the Western Cape accounting for the majority of numbers, while Limpopo has recorded a positivity rate of 1%. Let's talk about how the province is planning on dealing with the fifth wave. Limpopo Health MEC, Dr. Phophi Ramathuba. Dr. Ramathuba, good evening to you. Thanks for your time. Limpopo was one of the provinces that led the way in as far as vaccinations are concerned. Perhaps a picture of where we are with that process of at least trying to ensure that the adult population has been vaccinated.
Good evening, Kathy, and evening to all your viewers, and thank you for inviting us. Yes, indeed, as a province, we have always been vocal when it comes to the issue of intensifying our COVID-19 vaccination program, because we have seen that this is the only way we can be able to mitigate the severity of the resurgence should we find ourselves in that situation. As we are speaking now, as a province, our main focus now is to make sure that we get all those who are above 60. You would remember that when during the fourth wave, we had already made sure that above even 78% of those who are above 60 would have received a dosage or would have somehow received some form of vaccination, either fully vaccinated or with one dose. But then what we are currently doing is that we have noted that there could be a decrease in terms of immunity looking at the time and as we are approaching the fifth wave. Hence, we are strengthening now. We launched in the past week our booster vaccination campaign. The main focus is on that very category of the vulnerable, of the advanced age cohort of our citizens. We have been to Beggarsford last week. We've been to Thohoyandou, Thabane Mall. We've been to Giyani yesterday. Today we were in Polokwane, Limpopo Mall. And we are pleased with the current response by the senior citizens and even those who have got comorbidities. We have seen them coming forward, because in the past few weeks we saw that there is a lot of vaccine fatigue. Even amongst our staff, the morale was starting to go down. The population was starting to believe that COVID-19 is gone. But now we need to be vigilant, especially that we no longer have the lockdown restrictions that assist and aid us as a Department of Health in order to mitigate for COVID-19 infections rate.
Dr. Ramathuba, what would you say are the risks that are facing the province, especially when it comes to the fifth wave?
What we can indicate to you is that as we are monitoring the resurgence, as it is for us as a province, we can categorize ourselves as the low risk, because in terms of active case incidents, we are currently at 7 per 100,000 persons. And last week or previous week, we were at 3 per 100,000. So you would see that there is a gradual sustained increment on a 7-day average. But then while we are still at low risk, we are saying as a province, we are not an island. We are not outside the South Africa. We are not outside SADC. As the numbers increase in other provinces, as the number increase in our SADC regions, we have got major borders that are bordering South Africa and other neighboring countries, and Limpopo becomes the first stop. So that is why we remain vigilant, and our message to the people of Limpopo is to say, let's continue